This is Pocket Clinic, a friendly healthcare pet assistant that exceeds from a chatbot and can really feel like there's an actual mentor right beside the user. It turns symptoms into a doctor-ready packet, a clear next step plan, and guidance to those who feel hardship talking with the doctor. First, Pocket Clinic runs a 60-second health snapshot in order to examine and determine the context before unlocking the toolkit. The toolkit is an unlocked feature menu the user gets after completing the required health snapshot. You will see it later after this snapshot. This is required so the toolkit is based on real context and doesn't give random advice. It checks for urgent red flags, then shows results in clean screens instead of one long wall of text. So first, this is the health snapshot that asks for your context of your illness or disease. Oh, yeah. So it asks you about symptoms, checkup flow for condition, mental health, medication, test results. But right now, I will I will have a flu in this case. So symptoms, I feel sick, so I press one. So I can say since I have a flu, I can say I have a sore throat, um, a um, coughing a lot, really high fever, and I'll add a little spike to it. And sometimes um, too because I cough too much. Then it asks you a quick safety check if we have like really serious illness that can actually cause like near death situations. And if any of if any of the symptoms are in this list, then it'll suggest you to go to the hospital or the emergency center right away. But right now we don't have any of these, so I'll go with H. How long? Side around a week. So four. Let's say severe. You can say not sure, because for those like who don't have like a thermometer and like they didn't really measure it, they just felt like it was hot, they can say D as well. So this is again checking if they have like a really emergency symptoms, but I'll say a really B because it's mild pain. I'll say we're taking Tylenol for painkiller. It asks you any allergies, but we don't have any allergies. I can say that I am worried I will miss classes for a week. So now this is screen A. A pocket clinic never diagnoses. It gives a short list of possible causes to discuss and shows red flags so users know when something is urgent. So this is like the possible causes to for the disease of based off the context and information I gave it through the snapshot. And it was, says viral throat infection, respiratory infection, dehydration. Not a diagnosis, just a helpful short list for a clinic. Yeah. So now, next is for a simple plan. So then it creates a simple plan with urgency badges. Now, today, soon, or routine. So you instantly know what to do next, even if you're stressed, unsure, or don't know how serious it is. So it suggests me to do severe, had last 4 days. Oh yeah, so it's me saying click on today or tomorrow if possible. You can usually keep smaller options. To drink small frequent sips, water, clear soups, yeah. And then next is for the actual healthcare assistant. This is the part search engines don't do. A 10-second script and a one-page doctor packet you can actually bring to a clinic. It will help people who are afraid or feel awkward talking to the doctor by preparing them exactly what the doctor wants the patients to say and make the conversation easier to understand on both sides. So what to ask? This is for the user to like the AI is guiding the user to what to say to the doctor. Um, and honestly, for me, like I think I'll have a hard time talking with the doctor because I have some social anxiety. So I think something that can plan explicitly for my case, then it'll be a really good assistant in helping me um get diagnosed and help the doctor as well for smoother conversations. So it says that key things to mention, those things and questions to ask. These are like the important questions that I need to ask the doctor. And yeah, it'll plan what I have to say next. So next will give me the doctor packet. I can copy and paste to my phone or like any um to my phone so that I can get prepared before going to the healthcare visit. Yeah. And share if I can share it to my parents or school. Careful. Okay, so now that we finished the health snapshot, the user can access the toolkit, an unlocked menu of future features that turns your snapshot into real actions. So if you see the menu option, you see the back share care menu. We would like to go to menu. So the toolkit is unlocked, and there are the options that can help you um, get your symptoms really better. So, for example, the care option gives you a fully planned week. Yeah, fully planned week would provide what type of food to eat, and for those who are tired to cook, suggest healthy places to DoorDash. So if you see, I press 2. Shoot. Um, well, um, all right. It also gives you a healthcare near you by if you provide your zip code. So like, I live in Centerville, Virginia, and if I type that, it'll find a clinic near me. I'll say primary care. So right now, um, currently I'm using like a CSV file as a reference so that the chatbot can pull out locations that are near Centerville. So I put a CSV file as a reference and I added all the information in there. But if Playlab allows access to Google or other platforms, it will directly search the user's nearby location after the app gets permission from the user. So it gives you a lot of detail and like address, phone, hours. So then the patient know where he can go, like what time he can go. So now if you go to menu, there is the recovery planner. It basically gives you a 7-day plan after you visit your healthcare and gives you a fully planned week provided what type of food to eat, and for those who are tired to cook, suggest healthy places to DoorDash. So if I press 5, this is based off the snapshot. We just gave our information about our symptoms. So or it can base it off from a diagnosis from the healthcare. So since I want it to be based off from the snapshot, I can say um base it off not diagnosed yet. If I say not diagnosed yet, it will base it off from the snapshot. See, it says but sore throat, cold, cough, and fever. So meds, I'm taking Tylenol. No allergies. So energy level determines if you need the suggested healthy places to DoorDash, but I'll mostly want to low down when I'm lie down when I'm really sick, so I'll say 1. So here it gives you the 7-day recovery plan. Day 1 today, it says focus on hydration, rest, and fever control. Try small soft foods, only toast, crackers, bananas, applesauce, yogurt, plain rice soup. Warm drinks. Day 2, it suggests. Day 3 suggested. Day 4. And then it always says emergency help if you anytime notice any of these weird or dangerous symptoms. So now if we can go back to the menu. So the money help option is for those who need economic assistance, providing them nearby nonprofit organizations or clinics that can help and aid their situation. So this one, I'm currently using the CSV file again. Um, yeah, so it's going through the CSV files and it shows you the nearby nonprofit or clinics that can help you with healthcare costs, basic needs, and emergency help if you are in need of those economic situations. Yeah, it gives you like hours, phone address, so then it can provide like where to go. Yeah, and then it's really, I think it will be really helpful for those who are going through those economic hardships. Now let's go back to menu. There is, so we just did find care near me, money help. So the after visit decoder is basically when the doctors they provide you like information that are really hard to they're really hard to process. Using this um option, it can decode what the doctor is trying to say in simple words to the user. But right now we don't have anything, so uh please paste. Yeah, we don't really have anything. So we can go back to menu. And then care team share is an option that can help it's like nothing really fancy, but share options can like send an email to professors, workers, and any people the user needs to share their current situation of being sick with professionally suggested letters for teachers. Oh, let's say for the teacher, right? Um a normal email. Yeah, the privacy levels, just say um personal health reasons today. Extension on work and excuse for my absence. No, my name's Sam. So here I said a short one. I think if you go back, it's like pretty a normal email. But if I say provide more, but it gives you more options. So a formal option, more casual option, and yeah, it says well you can copy and paste it and send it to the teacher. So we can go back to menu. So now we have the sensory recovery journey is an option for those who diagnose a really serious um, disease like cancer, and it will help you emotionally support you while planning out what to do for to help the situation get better for those who feels exhausted, hopeless, and um, yeah, like yeah, it can support emotions, next steps, what to actually do, and both. We'll try both. But since now we don't have our diagnosis, the healthcare snapshot, didn't really say anything serious about cancers. We just said flu, so that's why it's asking additional questions. But if our snapshot was based off of symptoms that was cancer and our diagnosis was cancer from the healthcare, then it will provide an emotional support and sensitive recovery journey. But right now we don't have that much time, so we'll go back to menu. So nothing really much now. We just have the settings option that can change the language and the output styles. It can add more language, but I just did English, Korean, Spanish. I'll do Spanish, and then it will reset the whole thing with Espanol. And then this auto compact detail mode is the style of how the chatbot is going to output. Auto is the most recommended because it is also detailed but also simple so that the user doesn't get overloaded by words. Compact is more simple but lacks kind of detail, so I wouldn't really recommend it in case you're really you're in a hurry or like you need it right now. And detail is like really detailed, so it would require a longer time to use this app. So auto is the most recommended option, so I'll go auto. So this is all in Espanol now, so I don't really know how to read Espanol, so I'll go back to, can you go back to English? And then it will switch to English again. I push style is auto, and it will give you the options again. So this is it for the this is it for our app, the Pocket Clinic. So a Pocket Clinic doesn't replace doctors. It helps people walk in prepared assist in healing faster and efficiently and easier to navigate, especially when it's the hardest. Thank you.